thank you, Minister, for coming into the House to hear this commencement notice on the impact of prescribing sodium valproate epilim, which is a drug licensed in Ireland for the treatment of epilepsy and bipolar disorder. The teratogenic effects of valproate were first reported, in the 1980s and have been widely accepted since the mid-1990s. And indeed, last year, the French regulator said women taking valproate were 4 times more likely to give birth to babies with malformations. The type of birth defects attributed to the drug include spina bifida, autism and developmental problems, as well as the neural tube defects, malformation of limbs, digits and organs, and cleft palate. Bipolar women taking the drug were twice as likely to give birth to children with major birth defects. Now, Facts Forum Ireland is the umbrella group of the organisation that have been coming together to advocate for better services and supports for families and children affected by fetal anticonvulsant syndrome. The crux of the matter, Minister, is that parents were not informed of the risks or the risk reductions measures that were needed to be put in place. Therefore, they continued to be prescribed valproate during pregnancy. The European Medicines Agency introduced measures to strengthen the warnings and restrictions on the use of valproate in women and girls. And again, in February of this year, following a further review, they issued additional instructions aimed at further reducing the risks of this drug. While there is no definitive Irish data on how many children may have been affected by the exposure of valproate, Facts estimate that there are over 400 children affected since 1983, and I know some of these children, Minister. Our Ladies Children's Hospital in Crumlin have indicated that 43 children have received the diagnosis from fetal anticonvulsant syndrome. Minister, we urgently need an independent investigation on the historical prescribing of valproate to pregnant women. If you have decided, or the Minister has decided, that an independent investigation is not warranted, then I want to know why. I want to know the detail why if he's saying it's not warranted. We need an investigation to address if and how existing cases of facts could have been prevented, whether or not appropriate and timely information was provided to healthcare professionals and patients in line with the knowledge at the time, whether or not appropriate decision-making processes were in place concerning the treatment of women taking valproate in line with the knowledge at the time, whether or not appropriate regulatory steps have been taken over time to ensure patient safety, and how a system of redress should be established to meet the lifelong care needs of children and the impact of diagnosis on their families, in order to avoid the need for legal solutions for already burdened families. I believe the Valproate Project Group has met many times, but we are still waiting for the Department of Health to sign off on funding for this group. Has this funding been signed off, Minister? And this is one of the main things I want to go out here today. Has the money been signed off? And if it hasn't been signed off by the Department of Health, why not? Why hasn't it been signed off on? In November last year, the French government approved a 10 million fund to meet compensation, and they said that that was just a starting point for what they needed to do. In February of this year, the British Health Secretary Jeremy Hunt announced a review of how valproate concerns were handled in the past. Minister, a do-nothing approach is not acceptable in this state. Appropriate services must be put in place for these children and their families. Valproate-related disabilities are complex, wide-ranging and individual. Obtaining diagnosis in Ireland is difficult and lengthy. Treatment often involves attending a multitude of unconnected and uncoordinated speciality services, and often families have more than one child affected and in many cases are caring full-time for a number of children. It is therefore, and I'll just finish at this one, it is critical that appropriate supports are urgently put in place. I know families who are desperately in need of therapies and treatment, and they cannot afford them. You see, they have to give up work to care for these children with disabilities that were absolutely avoidable at the time. So they have no income and they have no means of getting the services and supports that they need. So that must be done. Thank you.
First of all, can I thank Senator Rose Conway-Walsh for raising this very important issue, and I totally accept that it is a hugely important issue, and it also crisscrosses into my own portfolio in relation to children with disabilities. As the Senator has noticed, the Oireachtas Joint Committee on Health recently published a report on sodium valproate and the fetal anticonvulsant syndrome, or FACS, following a meeting with the FACS Forum and the Health Products Regulatory Authority and the HSE. The Joint Committee's report, including a number of recommendations, all of which are being considered and are already being implemented by the HSE, by the HPRA and by my own department. The first three recommendations made by the Joint Committee relate to measures recommended by the European Medicines Agency, the EMA, on foot of a review of Valproate medicines that took place in 2017 and early 2018. Following the European Commission's decision to endorse EMA recommendations, Valproate medicines are now contraindicated in women who are able to have children unless the terms of special pregnancy prevention programme are met. This programme includes measures to ensure patients taking Valproate are fully aware of the risks and the need to avoid becoming pregnant while taking it. I am happy to report that the HPRA has already made significant progress in implementing the EMA's recommendations that fall under its remit. In March, for example, the HPRA approved an application to include a warning on the outer carton of the drug packaging in the form of a visual symbol and a boxed warning. The HPRA also has approved an application to include a visual warning symbol on the drug's blister pack. In early June, the marketing authorisation holder distributed the new Valproate education materials, which were approved by the HPRA, to all relevant healthcare professionals and patient groups. These education materials include a patient guide, healthcare professional guide, patient card and annual risk acknowledgement form as recommended by the EMA. Several of the recommendations made by the Joint Committee relate to providing a clear diagnostic pathway for children suspected of having FACS and establishing support services for children and families affected. This ties into the work of the HSE Valproate response team, which has developed a draft plan to address these particular issues. Officials in my department, the HSE, are now working together to identify the possible requirements in terms of infrastructure and resources. The Joint Committee also made recommendations concerning an investigation into the historic use of Valproate, and as well as consideration of the issue of compensation. I understand that there are several projects planned or early in progress that will give us a much clearer picture of the numbers potentially affected by FACS and of the information provided to patients and doctors at different points since the drug was fully licensed. I think it is appropriate to allow these projects to conclude in the first instance. Finally, with regard to compensation, I will need to give this further consideration as recommended by the committee. This issue is particularly complex given the number of different parties involved to one degree or other where a woman is prescribed and dispensed sodium valproate. Thank you very much, Carla.
Well, good. Briefly now, Senator Weir.
Yes, but I do want to welcome Karen Keeley, Chairperson of FACS, to the gallery, and Valerie Brennan, Danielle Delaney, Beverly Dunn and others, and I want to thank them for all the work they've done on that. Minister, the money is not there. The letter has not been sent out to the GPs. You haven't answered why that letter hasn't been sent out. There is medication still being given in plastic bags, and we need an independent investigation. To me, what you have said there is skirting around the problem. We need an independent investigation. I would please ask you to go back to Minister Simon Harris and to ask him to do that, because without the investigation, without the letters to the GP, without the funding for the services, it is not going to happen. It is not happening as you say it is in what you're saying here. It is not happening on the ground. I would talk to you further outside this because I know we have a limited time. But what is purported to happen is not happening, and it needs to be done immediately, because in the meantime we have parents watching their children and they're not getting the services, they're not getting the support, and every day we go by without the letter going to the GP, more women, more children are at further risk. This is a really, really serious problem that is not going to go away, and we cannot keep kicking the can down the road. Thank you, Minister.
Very briefly, Minister.
Thank you, Senator Conway-Walsh, again for her additional comments. And of course, any of the points she's raised during this debate today, I will absolutely bring them back to Minister Simon Harris, because I understand the seriousness and complexity of the issues facing the children and the families affected by FACS. And I am glad to see that there has been some positive engagement between FACS, the Forum and other stakeholders, including the HSE, the HPRA and the Department of Health. But can I just say there will not be any skirting around in relation to the issues you've raised here today. It seems clear also that there needs to be a European issue. It's also a European issue, rather than one that affects just Irish women and children only. And it's good to see that the European Medicines Regulator has now issued such clear guidelines on the safe use of this medicine. It's also good to see that our Medicines Regulator, the HPRA, has been working so diligently to implement the EMA recommendations. I hope the measures taken by the HPRA and the HSE and by healthcare professionals more generally mean that every woman prescribed the drug is fully aware of the implications of taking the drug, so we can make a properly informed decision about their own healthcare. But absolutely, of course, the issues you raised today, I'll bring them back to Minister Simon Harris and for further details on the issues of children, the independent investigation, the signing off of the funding, and also your point, a very strong point here in relation to the French Government. I wasn't conscious of that aspect to it myself as well. So there's an example of a European country responding to it. So these are all very important points, but just to give a commitment that we'll do our best, as far as I'm concerned, to support people in the best way possible. Thank you.
I'm sure if the matter isn't resolved, Senator Walsh will be back here again soon about the matter.